Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. The topic today is the basics of platelet-rich plasma therapy. It's a very exciting procedure. It uses one's own growth factors, platelets, and stem cells to regenerate damaged tissue. PRP, which is known as platelet-rich plasma therapy, PRP therapy for short, has previously been used for decades in dentistry, urology, ophthalmology, and other fields. But recently, over the last decade, it's become very popular in musculoskeletal medicine. The definition of PRP is a volume of plasma that has a platelet count above the baseline of whole blood. Now, regenerative medicine is what PRP therapy falls into. It is breaking the mold of conventional treatments. For instance, if you look at cortisone for pain management, it works well for epidural injections, it works well for joint injections, but it doesn't regenerate anything. It's a proverbial Band-Aid over the situation. So regenerative treatments can help heal, repair, restore the actual problem. What are the indications for PRP? They're fairly broad. Tennis elbow, golfer's elbow, rotator cuff tears or tendinitis, Achilles tendinitis, knee tendinitis, arthritis in joints such as the knee, shoulder, hip, ankle, and then ligament injuries such as around the knee. Athletes are using PRP like crazy. All the top ranked athletes and athletes who have gotten injured have, such as a lot of the Dodgers, Kobe Bryant, have opted for PRP therapy. Actually, going back to that for a second, all the major sports leagues are fine with PRP therapy. It's not a performance-enhancing drug. It's a therapy that is dedicated to just repairing and restoring, but there's no doping or anything like that involved. So even the World Anti-Doping Association is fine with it. How is PRP therapy performed? Well, it's a simple blood collection from the arm, just like at any lab. That blood is then put into a centrifuge and spun around to then separate the platelets into a concentration that's higher than regular blood. And as you can see, you end up with 3 layers: a platelet-poor plasma layer, platelet-rich plasma layer, and then the red blood cell layer. This is the layer that's used for the procedure. Okay, so it's put into the syringe and then it's injected into the area of concern. PRP therapy does promote inflammation. That's actually the first part of healing. Therefore, anti-inflammatory should be stopped prior to the treatment. It is usually painful for the first 2 days, or a little bit painful. It might not be dramatic, but so that's to be expected. And like I mentioned, professional sports leagues have not banned the use of PRP therapy. What are the outcomes? Well, there's numerous studies. I'm just presenting a couple here. One was looking at a knee study in 22 patients, no change in arthritis, and over 80% at 1 year with just 1 injection. Pain scores were decreased. Functional and clinical scores were dramatically increased at both 6 months and 1 year. Basic science studies have shown that PRP treatment may improve healing in many tissues. We don't have large-scale clinical studies yet. There was another study out of South Florida looking at PRP for tennis elbow in 30 patients who had tried everything, and the next step for them was surgery. Over 90% of them were able to avoid the need for an operation. More studies are needed to prove the effectiveness of PRP and to research the best ways to standardize the preparation of it. For instance, we don't exactly know whether leukocyte poor, meaning white blood cell poor, is the best way to go. We don't know if red blood cell poor is the best way to go. We don't exactly know. It's really just a lot of theories right now, but we do know that it works well. Risk-benefit ratio, it's your own blood. I mean, how much safer can you get than that? It's an outpatient procedure. The taking of the blood and the spinning of it and the putting it back in does happen within about half an hour, so it's not like they're taking the blood away and then giving it to you a week later. It's often done as a series of 2 to 3 injections, and this is based on your symptoms. If you're getting better, you don't need these subsequent injections. Right now, it's not covered by insurance, so expect to pay out of pocket, anywhere from $600 to $1,500, depending on the geography and who's doing it. And there's a very minor risk of infection. There's no real risk of rejection because it's your own blood. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics in the network accepting over 50 insurances and providing over 25 treatment options such as PRP with the board-certified doctors. Visit us online today at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.